Every day, Ugandan men die quietly, some from suicide, others from untreated depression, alcohol abuse, and preventable illness. Behind these deaths lies a painful reality. Many of these men never asked for help because society taught them that real men do not cry.
In Uganda, they expect men to be strong. So when a man comes and says that I'm facing through this situation, you look like weak or less a man.
But another question remains. Has the society done enough to protect them? Globally, around 75 to 80% of the suicide deaths are among men. And by these statistics, about 3,700 to 4,800 Ugandan men die by suicide each year. All these deaths are mainly attributed to mental health issues.
Men are brought up as machines. They're told, please do not say anything. You can already solve it out yourself. Why do you speak? Are you a weak man? So you're not supposed to come out and cry for everyone.
Whereas mental health is one of the leading causes of death by suicide amongst Ugandan men, it remains one of the least funded areas of health care.
In 2023, around November, Uganda enacted the Mental Health Act. But ask yourself, the act is there. Meaning that if the act is there, it means that it's at the policy level. It's a policy, right? But definitely one of the key issues is underfunding.
Across Uganda, thousands of men carry invisible burdens, financial pressure, unemployment, family responsibilities, and social expectations. Yet, many never speak about their emotional struggles.
Yeah, I started drinking when I was just 8 years because my dad used to brew, local brew, Tontwe. So all along I drank, and I thought I was a normal drinker. Not until I started now breaking out.
Uganda has a mental health act and national policies designed to improve access to care, but implementation remains uneven, particularly for services targeting men.
So we are going to look at the Ministry of Health. They are the first people to be held accountable. Even in terms of the policy they enacted, they are the ones to lead us, to give us the technical people to draft and operationalize the frameworks, the operational guidelines and all that. The moment you see a man come to a hospital in the night, just work on him, first priority. Just know it's an emergency. And the moment they withdraw, the next time you'll find them hanging in their houses on a rope.
Limited funding, shortages of mental health professionals, and inadequate community outreach continue to leave many without timely support.
Let's create deliberate platforms where men can speak without being judged. Those small statements, please stop them because they're sending very many men early into their graves.
While government services remain stretched, it is civil society organizations that continue to fill these critical gaps in mental health care. Experts, however, urge that these non-profit efforts cannot replace sustained public investment.
Another thing the government should do also to support organizations like OMF, Oma Government Foundation, who have come up to speak to the men and to also sensitize the men. Because we move to different areas and we really need financial support.
Why does mental health remain underfunded despite rising need? Are existing policies reaching the people they were designed to protect? And what specific interventions are in place for men who account for a large share of suicide deaths?
Here I'll call upon the government and NGOs and platforms to come up and help stand with men because men also suffer.